This patient had a trauma on tooth number 10 years ago. You notice it turning dark. So we did a traditional PA, and the diagnosis was a necrotic pulp with acute apical periodontitis. And you can see here that there is ligament thickness because she's also getting ortho. And you can see the peripathology here and also on the sagittal slice. So when you have a necrotic pulp, we know we are dealing with bacteria. We're dealing with bacteria. We want to make sure we get everything cleaned out. So I decided to use the Endocator on this case. Here I'm using the Endocator by Vista Apex here. And so what I'm doing now, I am finishing cleaning and shaping, and now I am getting ready to get a sample of the root canal and make sure that the bacteria level is very low. So here it is. We placed the distilled water already, and now we are aspirating the water back out, and now we are going to place it in our swab here in the Endocator swab. And you don't need that much liquid, just enough to coat that tip of the swab. And then we place it into the reacting agent. And then we shake it, shake it, shake it. Almost like I'm shaking down a pack of Marlboro cigarettes, but I'm not. So we have to shake it for about 10 seconds. So as we shake it, shake it, shake it, that moves the agent around. And then we place it in the back of the Endocator unit, push it down, and then we place test. And now it only takes 10 seconds, and I got a score of 25. Well, 25 and below is actually pretty good, but I want to see if I can get it lower. So I went back, irrigated, clean and shaped, used ultrasonics, and we are going to make sure we can get a lower score. So here it is. We are irrigating again with sodium hypochlorite, and we also using the Endo Ultra, and we're going to ultrasonically activate this for about another minute here. And we're irrigating and we're activating and making sure we can get that score down just a little bit more here. So we are activating it with ultrasonics here. And now we're going to rinse it out. And this is with alcohol because we want to dry it really well. And not only once we dry it, we want to aspirate it again using the distilled water. So here it is. We're looking to make sure everything is still looking good and everything is dry. And it's important to make sure that the field is isolated. So here I'm using paper points to make sure everything is nice and dry. Here using the paper points, I want to make sure that there is no exudate coming from the apex, or else that's going to throw off your numbers. So here we go. We are pulling out the sterile distilled water here. And we are placing a cap on it, and we are going to introduce it into the canal space once again. So we have the distilled water in there, and now we are putting another tip on, and now we're going to aspirate out the water, and we're going to get a sample of the root canal space here. As we pull it out, we're going to put it again on a new swab here. So as we open it up, we are putting the irrigants onto the swab from the root canal space here. This is the distilled water once again. And we are going to close it here. And as we close it, we're going to push it down. And again, we're going to shake it. And this time, we're going to shake it like a pack of Newport cigarettes. Shake it, shake it, shake it, shake it, shake it. Like for about 10 seconds here. And then now we're going to place it back into the Endocator here, and we're going to test it again, and let's see what our score is going to be this time. So as it's reading it again, this only takes about 10 seconds. Look at this score. This is a 2, so we went from a 25 to a 2. So now we know this is super duper clean, and also the bacterial level is pretty much undetectable in this case, and now we're ready to obturate. This is the cone fit here. Cone fit looks well. We use bioceramic sealer and single cone condensation with a very, very nice finish. The patient is going to get internal bleaching later. So this is some research on the Endocator, and I would suggest you to try it because you can't see clean on an x-ray.